You probably don't talk about it, maybe not even to your doctor, but late at night when the world quiets down and you're alone with your thoughts, the question returns, is it harmful to stop ejaculating as I get older? You might assume that your body just adapts with age. That intimacy slows down, and there's no harm in going weeks, or even months, without release. But behind that silence, your body is still responding, internally, physically, emotionally. And those changes, they're more powerful and more surprising than most men ever realize. After 50, your relationship with your body begins to shift. Maybe you've noticed a drop in desire, maybe health issues, medications, or even emotional fatigue have changed your patterns. For many, ejaculation becomes less frequent, not by choice, but by circumstance. And society rarely talks about what that means, but your body hasn't stopped functioning. It's still producing hormones, still regulating blood flow, still managing prostate health. So what happens when ejaculation stops? Does it cause damage? Does it help? Or is something deeper happening just beneath the surface? The answer isn't simple, but it starts with a surprising truth. Your body is designed for release. That doesn't mean you must ejaculate constantly, but rather that regular ejaculation plays a subtle, essential role in maintaining male health. Let's start with the prostate. This small gland is responsible for producing the fluid that nourishes and transports sperm. Without regular ejaculation, fluid can build up, potentially leading to congestion in the prostate ducts. Some researchers believe that infrequent ejaculation may contribute to a higher risk of prostatitis, an inflammation of the prostate that causes pelvic pain, urinary issues, and even sexual discomfort. Even more eye-opening, a major study published in JAMA found that men who ejaculated 21 times per month had a significantly lower risk of developing prostate cancer than those who ejaculated less frequently. While this doesn't mean more is always better, it raises an important question. What happens when you do nothing for months at a time? And then there's testosterone. Regular ejaculation has been linked to maintaining hormonal rhythm and balance. Prolonged abstinence may not directly lower testosterone levels, but for some men, it coincides with declining libido, confidence, and mood, partly due to the psychological feedback loop of disengaging from physical intimacy. The changes aren't just physical, they ripple into your emotions. Over time, long periods without ejaculation can lead to sexual disconnect, shame, and even subtle depression. Not because of the act itself, but because of what the absence symbolizes: disconnection, silence, retreat. So the body holds it in, the emotions too, but they don't go away. But here's the part you haven't been told. Not ejaculating doesn't always mean something is wrong. In fact, under the right circumstances, it can offer profound clarity, control, and healing. This is where intentional abstinence differs from neglect. When chosen mindfully, abstaining can give your body time to reset. It can help you redirect your energy, tune in to emotional needs, or reconnect with your partner on a deeper level that isn't purely physical. Some men even experience increased sensitivity and stronger erections after a short break. Tantric traditions have long emphasized the spiritual and energetic benefits of delaying ejaculation, claiming it heightens awareness and builds long-term stamina. But the difference is intention. Are you choosing to pause, or are you disconnected from yourself entirely? Because when abstinence is unintentional, born out of shame, neglect, or fear, it becomes something else, something that chips away at your vitality, one silent day at a time. So, what should you do? If you're not ejaculating regularly, ask yourself why. Is it physical discomfort, low desire, medication, emotional withdrawal. The body is always trying to tell you something. It's your job to listen without judgment. You don't need to count ejaculations like reps at the gym, but you do need to stay connected to your body, whether it's once a week or once a month. Maintaining some form of sexual expression, solo or partnered, supports not just your prostate health, but your mental clarity, your confidence, and your emotional vitality. And remember, ejaculation isn't just about release, it's about circulation, hormonal rhythm, pelvic health, and even sleep quality. It activates parasympathetic pathways that help you relax, reduce tension, and balance mood. For older men especially, it can serve as a powerful natural way to relieve stress and sleep more soundly. The key is reconnection to yourself, to your body, to the signals you've been taught to ignore. If you've gone a long time without ejaculation, don't panic. Your body is resilient. It's never too late to reconnect with your health. Start by having honest conversations with yourself, your doctor, your partner. Begin with awareness, not guilt. Make space for pleasure again. Not just physical pleasure, but the emotional peace that comes with living in a body you don't avoid. Your masculinity isn't defined by performance. It's defined by how well you listen to your needs. Because this stage of life isn't the end of intimacy. It's the beginning of a deeper, quieter, more meaningful connection. One that doesn't rush. One that respects your pace. One that allows room for healing. So whether you choose to abstain for reflection or reintroduce ejaculation as a tool for balance, make it a choice, a conscious act of care. You don't need to prove anything to anyone. You only need to stay present with yourself. And that's the most powerful release of all.